Hello, I am Dr. Katie Brown, a clinical audiologist at Kingman Regional Medical Center. And today I'm going to talk to you about hearing loss, communication, and hearing aids. How common is hearing loss? Approximately 17% or 36 million U.S. adults report at least some degree of hearing loss. That means that there are probably many more adults who may have slight hearing loss and not even realize it. For people ages 75 years and older, about 48% of them have some degree of hearing loss. So we're going to start by talking about the parts of the ear and how we hear, and then we're going to talk about what hearing loss is. So to hear, your pinna picks up sound from the outside and filters it down into your ear canal. The sound travels through your ear canal and then vibrates your eardrum, which in turn vibrates the ossicles behind your eardrum. And that causes a vibration or a wave in the fluid in your inner ear. And then that wave is picked up by little cells, little neurons inside your ear, and the sound is transmitted to your brain. There are two different main types of hearing loss, and those types of hearing loss pertain to where in the auditory system the problem lies. The first type we're going to talk about is conductive hearing loss. Conductive hearing loss occurs when an ear condition causes sound to be attenuated as it travels through the ear. So some of the things that can cause a conductive loss of hearing include a big chunk of wax in your ear, a hole in the eardrum, or if you have middle ear fluid, among other things. These issues can cause sound to be attenuated as it travels through your ear, causing a conductive loss of hearing. Many conductive hearing losses can be treated with medical intervention. A second type of hearing loss is called sensory neural hearing loss. This is the most common type of hearing loss, and it occurs when the little cells in your ear that pick up sound and send them to the brain are damaged or dead. What you can see here is a photograph of normal hair cells, and you can see how they're lined up beautifully, one row after another. And then on the right side, you can see what it looks like when those cells are damaged. When the cells in the ear are damaged, they are not going to be able to be repaired or replaced by the body. And so it typically leads to a permanent type of hearing loss. The most common type of hearing loss, as I mentioned, is sensory neural hearing loss, or damage to those hair cells in the inner ear. And once that damage is done, it is most often permanent. At birth, most people have about 16,000 hair cells in each ear. And once they're gone, and they aren't able to be regenerated. So what kinds of things can cause hearing loss? There are many things that can affect your hearing, and some of them include exposure to loud noise, aging, some medications, certain diseases, whether they're of the body or of just the ear, genetics, and trauma. Noise exposure is probably one of the most common causes of hearing loss. Many of my patients have been exposed to construction noise, firearms, or other loud noises throughout their life without hearing protection worn, and thusly have a hearing loss because of it. So what are some of the signs and symptoms of hearing loss? Well, you probably have some friends, or maybe even you, who've had some of these issues. And maybe you think that it's somebody else. Maybe somebody's not talking clearly. Maybe the TV is too soft. If you feel like when people talk to you, things sound muffled, if you have difficulty understanding speech when you're in background noise, if you have to ask people to speak more slowly, or if you feel like they need to speak clearer, if you have to turn up the volume on your TV and you feel like people constantly tell you that it's too loud, or if you feel like you don't even want to talk to people because they don't speak clearly. Some other signs are if you tend to avoid social situations altogether. As well, if you have difficulty talking on the phone, or if you misunderstand often what people say to you. And many people that I come across make excuses. As I was talking about before, I hear all the time, my wife does not speak clearly. My kids mumble. Anytime my sister is on the phone with me, she doesn't speak loud enough. And those are some pretty good signs that there could be a problem. Hearing loss has many side effects for not just the people suffering from hearing loss, but sometimes their family members as well. Some of the most common side effects of people who have hearing loss may be depression, reduced cognition, reduced functional health, fatigue, frustration, decreased job performance, increased risk during an emergency, and tinnitus, which is the name for ringing in the ears. So what do you do if you think that you may have a hearing problem? Well, it's recommended that you have your hearing evaluated. So how is hearing evaluated? Well, hearing evaluation is a process that involves tests of auditory function that can evaluate the different parts of the ear, how they're functioning, and what type of problems may exist. So during hearing testing, we measure auditory function. We measure how sensitive your ears are. We measure your ability to understand speech. And we also measure the function of your middle ear. The results of your hearing test are plotted on something called an audiogram. So what you see here is an audiogram. And on this audiogram, we see across the top frequency. So an audiogram plots your hearing from low pitch to high pitch. And then on the other axis, we see loudness, with really soft sounds being at the top of the graph. And as we go down the graph, the sounds are louder. The X's represent the results for the left ear, and the circles represent results for the right ear. And this is just a hypothetical audiogram. But we're able to plot the degree and configuration of a person's hearing loss on this graph so that we can make a depiction to show people what their hearing loss actually looks like. So when should you get your hearing tested? Well, definitely, if you notice a change in hearing, whether it's sudden or gradual over time, it is important to have it evaluated. Also, if you have an increased difficulty understanding speech, or you feel like you're having any of those issues that we spoke about, it's important to have your hearing tested. If you are around loud noise, not only should you be wearing hearing protection, but you should also be having your hearing monitored so that you can determine if the noise is having any effects on your hearing. If you develop any ear symptoms, if you have pressure or pain or ringing in your ears, that's also a good time to have your hearing evaluated. And then we recommend that you have your hearing evaluated once you hit the age of 50 to get a baseline of your hearing status so that if any changes were to occur beyond that, we have something to compare to and can kind of get an idea of how quickly your hearing loss has progressed. Otherwise, for people with normal hearing or who do not fall into these categories, it's good to have your hearing evaluated about every 3 to 5 years to determine if there's any change. So where can you get your hearing tested? Kingman Regional Medical Center has a clinic, KRMC Speech and Hearing Specialists. We have 2 licensed doctors of audiology to provide diagnostic hearing testing as well as other services pertaining to your ears. We test patients of all ages and can also discuss with you options for treating your hearing loss. Next, we're going to talk about some communication strategies. These are strategies that can help everybody understand speech better and communicate more effectively. Even the normal hearing listeners that I speak to about their hearing problems would benefit from using these strategies. So some of the most important things to do, whether you're communicating with somebody with hearing loss or not, is to face the person that is speaking. That way their voice is being sent directly to your ears and you're able to lip read, which is point 2. You also want to make sure your environment is well lit so that you're able to see the expression on the person's face, which can add valuable information to the message that they're trying to speak to you. You also want to decrease the distance between you and the speaker to make sure that their voice volume is getting to you at an adequate level. And you want to eliminate background noise whenever you can. Communicating in noise is almost always more difficult than communicating in quiet for everyone. Next, we're going to talk about hearing aids. Hearing aids are one way to treat a sensory neural hearing loss and some conductive hearing losses. Now, a hearing aid is an electronic device that enhances your hearing so that you can hear sounds in a more normal way. Why is it that with hearing loss so prominent in the United States, only 1 in 5 Americans with hearing loss uses hearing aids? These are some of the most common excuses that I hear, and I'm going to address some of them. So people often think of hearing aids as a big, ugly, beige chunk of plastic that they wear over their ear. But hearing aids nowadays are a lot more attractive and comfortable and a lot more natural than they used to be. And so that is something that we can discuss at your appointment. As well, people say, well, old people wear hearing aids. I don't want to be an old person, but I have fit even babies with hearing aids. So hearing loss isn't necessarily something only affecting older adults. I've also heard a lot that people have tried hearing aids in the past and that they just didn't work. Many times these patients have hearing aids that were not appropriately selected or fitted on them, and that's why they're experiencing the trouble that they're having. There are, in general, 2 different styles of hearing aids, and you've probably seen some of your friends wearing them. The first style is called a behind-the-ear hearing aid, or BTE. Behind-the-ear hearing aids come in different varieties. Some that have an ear hook that hooks over your ear and a large tube that connects from the hearing aid to your ear. And then open fit devices, or RIC devices, are devices that have a small wire that connects to your ear canal. The second style of hearing aid is an in-the-ear hearing aid, or ITE. These devices are custom molded to your ear and do not have a piece that goes behind your ear. So how do you know what type of hearing aid is right for you? Well, that's where it's important to seek a professional's help. And that's what I'm here for. There are some factors that we consider in choosing a hearing aid style and design for a particular person. And some of the things that we consider when we're making the decision with our patients is the type of hearing loss, the severity of the hearing loss and what your amplification needs may be, your dexterity, and the aesthetics. And just because your friend has a certain type, brand, or style of hearing aid doesn't mean that that may be the most appropriate device for you. So that's why it's important to talk to a professional about your specific needs. So what do hearing aids cost? That's just like going onto a car lot and saying, what does a car cost? Because there's a lot of factors that can influence the price of hearing aids. The specific things that may affect the price of your hearing aid includes the level of technology. So there are hearing aids that are very basic, and there are hearing aids that are considered advanced or premium hearing aids. And the level of technology can affect the price point. What style are they? In some cases, really small hearing aids that fit deep inside your ear canal may be more costly than devices that sit outside your ear canal, depending on the provider and the clinic and the other specifications. The quality of the devices. So there are devices that can be purchased at your pharmacy, and then there are devices that can be purchased from a hearing care professional or a licensed doctor of audiology, and the quality of those devices may differ. Also, something that may differ and may affect the pricing of a hearing aid is what services are included in the hearing aid package. Some devices are sold with no service at all, so you are just purchasing the devices. And some devices are sold with an entire care package that includes service and batteries and care for a certain amount of years. All of those things go into how devices are priced. One important thing to note with your ears is that if you do not use it, you lose it. And that doesn't necessarily mean that if you don't use a hearing aid, you're going to go deaf. But what can happen over time is if you have a significant hearing loss and you're not using amplification or anything to aid your hearing, usually we can see a change in your ability to understand speech over time. That's why it's so important to address your issue when you first start noticing a problem. So how do you pick a hearing care provider? How do you find somebody who you can trust? Well, the first thing you want to look for is a licensed audiologist or ENT. These medical professionals do have expertise in your hearing system and the pathology of hearing and are able to treat the underlying cause of your hearing problem. When choosing a provider for your hearing aid needs, these are some of the things that you want to look for. You definitely want to find somebody who's not going to pressure you into purchasing hearing aids. Many times I speak to patients that felt pressured to sign a contract that day, or they weren't going to get the special price, or they didn't feel comfortable making the decision, but they bought the hearing aids before they left. That's something that you should never do. I always like to leave my patients with an option to go home and think about their decision so that they're making the right decision for themselves. You also want to make sure that you have warranties and guarantees on your devices. Some devices will come with a 2 or 3 year warranty, as well as some service that is included on the devices. And you also want a provider that offers you follow-up care. Many times I've seen patients who got their hearing aids and they never returned to their hearing care provider because they either didn't know that was an option or nobody had discussed that with them when they were fitted with their devices. But follow-up for hearing aids is essential to your hearing aid benefit and maximizing your ability to hear with the devices. You also want to make sure that you pick somebody that you are comfortable with, because you should be seeing them for follow-up, and you will be seeing them for your hearing aid needs for the length of time you have your hearing aids. So you want somebody that makes you feel comfortable, respected, and somebody that you can trust. How do you get the most benefit from your hearing aids? Well, there are some important factors that relate to this. One thing is that as a professional, it's my responsibility to help you understand what hearing aids are capable of doing for you and what they cannot do. I always try to leave my patients with an appropriate understanding of what they can expect to achieve with their hearing aids. You also are going to perform the best with your hearing aids if you're implementing those communication strategies that we discussed earlier, making sure that you are face-to-face with the person you're talking to, make sure that they get your attention before they talk to you, and decrease background noise whenever you can. You also want to make sure that you are notifying your provider if you're having any problems. We are here to help, and we want you to let us know if you're having a problem. Please consider KRMC Speech and Hearing Specialist for all of your hearing needs. We perform services from hearing evaluation and rehabilitation, hearing aid consultation, programming, and dispensing. We can even test you if you are experiencing dizziness. And for those little swimmers, we provide custom swim plugs, and we can provide custom hearing protection for people who are hunters and have other loud hobbies. This is a list of resources so you can learn more about being hard of hearing, your tinnitus, and other things pertaining to hearing loss. Once again, I'm Dr. Katie Brown, the Clinical Doctor of Audiology at KRMC Speech and Hearing Specialists. Thank you for spending this time with me. And please, if you have any questions about your hearing or want to learn more about our services, please give our office a call at 928-681-8717 and have a great day.